The health benefits of breastfeeding are well established. But what if we looked at it from a different angle and examined the costs of not breastfeeding? In that case, we would be faced with shocking figures of maternal and infant deaths and billions of dollars in medical and non-medical costs. My guest today is Dr. Melissa Bartick, Assistant Professor of Medicine at Harvard Medical School. She conducted an in-depth analysis of the maternal and pediatric health outcomes and costs of not breastfeeding in the US. I would like to add a disclaimer here and say that Dr. Bartick doesn't have any affiliation with the Kala Suckling Pump, which is a side project of the Let Down podcast, and she received no compensation for her participation here. She, just like my other guests, is an independent expert, and we came together for this chat with the shared intention to help and promote breastfeeding in whatever way we can. Please make sure to like and subscribe, hit the bell for notifications, and now enjoy the talk. I am here today with Dr. Melissa Bartick. Melissa, thank you for joining me.
You're welcome. Thank you for having me.
So the health benefits of breastfeeding are well established, but the cost of not breastfeeding is not talked about enough. The analysis you have made is called The Burden of Not Breastfeeding, and it is looking at all the pediatric and maternal costs of suboptimal breastfeeding in the US. The most recent version is from 2016, and it is an update of two previous studies made in 2010 and 2013. Based on this analysis, the costs attributed to suboptimal breastfeeding is shocking, to say the least. 3,340 infant and maternal deaths, $4.3 billion in medical and non-medical costs, and an additional $14.2 billion in premature death costs, which refers to women's death before the age of 70, which would be the average lifespan. So these shocking figures speak for themselves about the importance of breastfeeding. But apart from these figures, what do you think are the most important conclusions of the analysis?
Well, so the cost of premature death is the death of both women and children. I just want to clarify. I think the most important thing is that 80% of these excess deaths and medical costs were maternal, and only 20% of these costs and deaths were pediatric. But most people think of breastfeeding as a pediatric health issue. And when people talk about things like finding the best formula to substitute for breast milk, for example, that ignores the whole maternal aspect of breastfeeding. So even the perfect formula will do nothing to lower the risk of maternal disease. And the only way to do that is for a woman to breastfeed.
Yeah, you mentioned it, that this should be a consideration as a fundamental fact in any strategy focusing on women's health from now on. Is this figure coming from 2016? So this is like a progression that you have seen starting from 2010 to 2016, or this was obvious already in 2010?
So 2010, we used a very simple method to calculate just the pediatric costs. And then in 2013, we used a very sophisticated computer modeling to look at the maternal costs. And then with this later study, we used the same kind of sophisticated computer modeling to look at the combined maternal and pediatric costs. So it was a different study than the other two studies, not just an update, but a totally different study.
I see. Do you think the fact that it has such a larger impact on women's health than previously appreciated, would that draw larger efforts towards supportive policies, towards more lactation care? Do you think it would have that effect?
Well, it should have that effect, but right now I'm not seeing it. I'm not seeing people taking advantage of that knowledge, really. So far, the conversation has still been about things like whether breastfeeding is really worth it for your child's health, and if formula is really just as good or almost as good as breastfeeding. And we're really not seeing a lot of attention and funding for breastfeeding coming from the women's health arena either. We still really need to reframe breastfeeding as a women's health issue, but we have not really succeeded in doing that very well yet.
I wanted to ask you a little bit about how you go about creating a complex analysis like this one. Could you explain that a little bit in layman's terms, because it seems such a big undertaking?
It was a very big undertaking. We used a computer modeling, as I mentioned. It was pretty complicated. So basically, we took two populations of hypothetical women and their hypothetical children. And each population had 100,000 women, and we followed them from age 15 to age 70. And we looked at the children that they would have born over that time and what diseases they would have developed. And in one of these populations, the women breastfed at the current rate of breastfeeding in the United States. And the other population, the women breastfed at what was the recommended rates at that time. So we had 95% of the women breastfeed exclusively for 6 months and then go on to breastfeed for a year, which was the recommendation at that time. It's now 2 years. That was the US recommendation. And then we simulated these populations 10,000 times to see what would happen. And then we looked at how many times in these populations the women and children got various diseases according to what the literature would say, like, so how many ear infections they would get, how many cases of breast cancer they would get, how many cases of ovarian cancer, and etc., over about 14 diseases that we looked at in women and children. And so we compared the outcomes, one for the population with the optimal breastfeeding rates and one with the suboptimal current breastfeeding rates. And then we just subtracted the differences in rates of diseases and their associated deaths and costs. And then that's how we arrived at the cost and death figures.
I understand. You mentioned about the previous analysis. I know they are not directly linked here, but was there any other notable positive or negative changes throughout these 6 years where you were doing these 3 studies that was kind of obvious for you that this is a big change in the circumstances of breastfeeding?
So you might think that we could have just added the $13 billion we got in the 2010 study with the figure we got from the 2013 study, and you would come up with this really giant figure, which the figure we got in the last study was less than what would have been added from the other two. And partly it's because we use different methods, and partly it's because we cut out some of the diseases that we used for pediatrics in the first study, because there were more studies done that showed that some of those diseases, like diabetes in children, were less linked to not breastfeeding than what we thought was true back in 2010. So we didn't count those diseases. So we got a different number. And then, of course, we used a different methodology than we used in 2010. So we still got a pretty high level of costs and deaths, but it was less than what we got in 2010 for the pediatric part. But even so, the maternal part is still quite high.
Quite shocking, yes. You mentioned that the current social constructions in the US, like the lack of paid maternity leave and appropriate lactation care, make it difficult for women to keep on breastfeeding. And the PUMP Act was a recent victory to support working mothers in their efforts to breastfeed, which is great. But still, it seems in the far distance that something like a 6 months paid maternity leave would become reality in the US. How do you see this situation? How important something of a 6 months paid maternity leave would be in increasing breastfeeding rates?
Well, I think paid maternity leave is very important. 6 months would be great, and that would be considered generous here, where a lot of people don't even get, a month or get anything at all. you have here a lot of people who work full time and they're still living in poverty and having to work multiple jobs. And so even if they got paid leave at 100% pay, they would still be in poverty. And so that is a terrible issue in terms of paid leave. So paid leave is just one part of what is necessary to help with breastfeeding, because it depends on what country you're in and where you're at. So you could have a country like Canada, which has paid leave, which doesn't pay a lot, but they do have paid leave, but they don't have the best support in hospitals and elsewhere. So you have people home on leave, but then, not long after they're giving formula because they don't have other aspects of support. And then you might have a situation like we have hospitals here. There's a hospital near where I live that is baby friendly, and they do everything very, very well in that hospital, but they have a population that is very challenged socially and has a lot of hardship. And so even though they provide absolutely optimal support for breastfeeding, their patients are not breastfeeding at very high rates, even in the hospital, because they don't have all that other support, as they have so many hardships. Now, they would be breastfeeding at even lower rates if they weren't baby friendly, but there's just a lot of things that need to happen for breastfeeding to succeed, and paid leave is one of them, but so many other things need to go into it. One thing that really needs to happen, not just here in the US, but probably other places, is that raising the minimum wage would be very helpful to help breastfeeding rates. There are people that just can't make ends meet, and they need to go back to work. They can't, even if there's paid leave available, they can't take it, because if they don't work, they don't get paid, and they have to go back to work almost immediately. They can't even recover from childbirth. And of course, if you think about it, if you get paid leave, that's not even 100% of your pay, and you can't even make ends meet at your full level of pay. And now you have a new family member, so you have even more financial needs than before. Of course, you're going to have to go back to work as soon as possible. So all of those things work against people and work against breastfeeding. There are a lot of things have to be put in place.
Yeah. I suppose something like a increase in the minimum wage is such a fundamental and very hard step to make. Do you see any immediate steps? Where do you think it would be most necessary and most actionable? Something additional support that is kind of around the corner and achievable in the short term. Do you see any of those actions in sight?
Not in the United States, no. There's not the political will for any of that right now. And just the opposite. I think there are politicians who would not want the minimum wage raised. If anything, they are trying to cut all the benefits they possibly can to working families. I mean, there are politicians who are actually trying to slash benefits to poor working families and make their lives harder.
And how about I found from conversating with other especially breastfeeding support groups, that the support of family, the immediate surrounding of the mother is very influential in how long they will carry on maintaining the breastfeeding. So how much acceptance they get from their family members, their close kind of cultural surrounding really is impactful. Do you see that as a good place that's a place where you can improve the situation without big policy changes necessary?
Well, that's not necessarily easy either. So, a lot does depend on who's around the mother, and if she has peers who breastfed, if she has a supportive family and friends who breastfed, especially if her partner supports breastfeeding, if she feels comfortable breastfeeding in public, and some of that has to do with whether her partner supports her breastfeeding in public and whether her community supports that. There are things like baby cafes, which are becoming more and more popular, which help give breastfeeding support and provide women with networks of breastfeeding support. And all of that's helpful. Women who are from cultures where breastfeeding is very common, that's helpful. But women who come from cultures where breastfeeding is not very common, are at a disadvantage because there are fewer people in their lives who know how to breastfeed and who can provide any kind of practical support. But yeah, you still need policies to try to make that happen, to try to reach those people who come from communities where there are historically low breastfeeding rates, like in the United States. The non-Hispanic Black population has a historically low breastfeeding rate. And so, building that community up so that there are peer supporters in those communities, takes a lot of investment. And we are making that happen, but that still takes policies and investment and training, and it's a lot.
Yeah, it's a lot of resource,
Mm-hmm.
but it's still less than the cost of it. What we see from the economic social costs of the billions, it's still less than that.
Yeah, I mean, there's a lot of organizations who are working actively on those kinds of issues, but there are other factors that are involved in making things really difficult for breastfeeding mothers, especially. So, for example, one thing in the United States and probably a lot of the industrialized world is that there's this expectation that women are supposed to be exclusively breastfeeding their infant, but there's also this expectation, especially in the United States, that women should never be sharing a bed with their baby ever. And there's also this expectation that good babies sleep through the night. And all of those things are contradicting each other. Because the physiology of breastfeeding is that the normal human physiology is that breastfeeding mothers and infants do sleep together and they breastfeed throughout the night. And they're not really fully awake. They just breastfeed all night long and they get a good night's sleep and they wake up pretty refreshed. And that's what normally happens. They aren't supposed to sleep through, the babies aren't supposed to sleep through the night. They're not supposed to sleep. They don't sleep separately. And yet, women are hearing these contradictory messages and they're, getting up at night and hovering over babies' cribs to try to get them to sleep separately. Of course, the baby doesn't want to sleep alone in a crib, and the mothers are getting up, trying to feed their babies separately somewhere else at night, and they're being exhausted and they just can't do it. You have to, if you are sharing a bed with your baby, you need to know how to do it safely, and there's circumstances where it's definitely not safe. The Academy of Breastfeeding Medicine has a couple of handouts on bed sharing and breastfeeding, and a new handout on physiologic infant care that talks about this, and I was involved in creating those things. But this is one of the things that undermines breastfeeding, and one reason why moms either give up or they end up bed sharing anyway, but they need to know how to do it safely. So these are the kinds of things that, day-to-day things that families need support in.
Yeah. And there is so much pressure on the mothers, as you were just mentioning as well, that there are contradicting not just advice, but expectations that they would need to be able to somehow accommodate. And I think that we do put that pressure on ourselves to try to make that work. And it's definitely not good for either the mom or the baby to try to do that. I think the perception for me, what I found, especially in the US, it's very dominant, the perception that breastfeeding is a mother's choice as opposed to a public health matter, a matter of public health. And I think the public generally looks at it that way, and that's why the expectation comes with it, that it's something a mother chooses to do, as opposed to providing a sort of public health service by breastfeeding her infant. Do you see this in any way as an obstacle in better support for mothers? How the public sees breastfeeding?
So, 20 something years ago, when I started to get interested in breastfeeding, it was framed as a lifestyle choice, but in the last, I don't know, quite some time, at least where I live in the northeastern United States, it really has not been seen as a lifestyle choice. It's been an expectation that most people want to breastfeed. In the United States, over 80% of women start out breastfeeding. So people want to breastfeed, and largely because they know that it's healthier for the baby. I'm not sure a lot of people know that it's healthier for them, the mothers as well, but people want to breastfeed, whether they know it's, quote, a public health issue or whether it's just healthier for their baby, I'm not sure, but people want to breastfeed. So it's not really seen, at least around here, as a lifestyle choice. People want to do it.
But that's the mothers. How about the people who surround the mothers? I'm thinking about the general public, everybody else, because I think mothers do get a good knowledge during their pregnancy about the importance and the health benefits of breastfeeding. But it seems to be that that knowledge stays with the moms, or only focused on the moms, as opposed to a wider public.
Well, I think that depends on what generation people are. So it may be that older people may see it as a lifestyle choice. So an older person who is going to scoff at a woman who's breastfeeding in a restaurant may be the kind of person who sees it as a lifestyle choice and says, why don't you go do that in the bathroom? So that might be an older person, but I think that kind of attitude has been evolving.
Oh, great.
I really do. When my children are in their early 20s now, and when I had them, it was not common to see people where I live breastfeeding in public. Not at all common. And now it's just, you will always see people breastfeeding anywhere, everywhere. And I have for many years now, commonly see people breastfeeding everywhere. So, things have changed. I do live in a state which, does have fairly high breastfeeding rates. But things have changed. Fortunately, despite all the aggressive efforts of the formula industry, but things have been changing.
That's good. That is a silver lining. Okay, Melissa, that's all the questions I had. Is there anything else that you would like to add to this?
I do want to make people aware of those resources from the Academy of Breastfeeding Medicine. The website is bfmed.org.
I include that in the description as well.
Okay.
Well, thank you very much then.
You're welcome. Let me know if there's anything else you need.